and a number of city leaders who will be involved in the response to homelessness. And we are here today to share updates on our mobilization efforts and our centralized focus to help focus on our downtown area in response to the homelessness crisis. I want to recognize Public Works Director Eric Lopez, Paul Duncan of Homeless Services, Fire Battalion Chief Jason Hosea, and Police Chief Wally Hebish. They're standing with us today in solidarity, and they're all in on our response to homelessness, specifically today discussing downtown. Earlier this week, the City Council adopted the proclamation of a local homeless emergency. This proclamation of emergency will allow us to tackle this crisis head on with a faster, more expedited level. It also allows us to mobilize local resources, coordinate interagency responses, accelerate procurement of housing units, seek assistance from the county, the state, and the federal governments. This increase in focus and funding and resources will also support our outreach efforts for our unhoused neighbors and will allow us to effectively, with both compassion and with urgency, be more strategic and focused in our response to homelessness. I want to thank our city manager for bringing this proclamation forward and our entire city council for their support. While we enter a new frontier in this new emergency proclamation, this action should come as no surprise to anyone. We've been dealing with housing issues and homelessness for quite some time. Since 2017, we've seen a 17% increase in homelessness. Of those experiencing homelessness, there's an overrepresentation of Black people, Pacific Islanders, an increasing number of veterans, and people with physical and mental illness, as well as substance abuse issues, and those experiencing violence and domestic violence in their lives. Homelessness also creates a potential public health and public safety risk in our city. And while we've worked diligently to address this issue, there's now a request for us to take further action and step up on behalf of all of us. Our response today, it needs to be compassion-focused, but it also must be about safeguarding public safety and preserving order in our community. So let's talk about our current efforts in downtown. Since the proclamation, we've activated our Emergency Operations Center and announced our incident command structure led by the Health Department and the Public Works Department and comprised of city staff from nearly every department in the city. Beginning today and throughout the next 3 weeks, we'll centralize our focus and our resources in the downtown area. This includes street-level outreach and the deployment of new mobile access centers. That's going to be able to connect people directly, people who are experiencing homelessness directly with services and resources specifically within the downtown streets. We're also calling for federal, state, and regional support in responding to homelessness. This includes declarations of emergencies in the state and in collaboration with adjacent cities and communities. Other areas that we're currently focused on includes identifying sites for safe parking and additional shelter capacity, establishing grant funds for impacted small businesses and local businesses, and conducting area-specific strategy meetings across our city and high-need areas to better coordinate the delivery of services. Now, there's more to come in the future. Today is the second day since this emergency. We have a lot of things in the works, and we want to continue to discuss and identify ways to support people experiencing homelessness. I look forward to working with city staff to develop an initial strategies in support of our Opportunity Beach agenda, which I announced on Tuesday at the state of our city. These can include efforts to localize mental health support in our cities, localize substance abuse services, add more affordable housing to our stock, and increase access to fair housing through the Long Beach Housing Promise, and we'll begin meetings on that very soon. We also want to ensure economic stability for residents now and also think about long-term solutions because we can't exist in an emergency forever. Homelessness is one of the biggest issues currently facing our city and our entire region, and we have a whole lot of work to do. I assure each and every member of our community that the City of Long Beach is working hard to restore faith and trust in those we serve. A long-term resolution and end to this crisis will require a dedicated focus from all of us. Everyone deserves dignity and a second chance, Everyone deserves to have tools and resources and to not only survive, but to thrive. We can't do it alone, and we need support from our entire community. In the coming days, we'll announce ways everyone can support through the Mayor's Fund for Homeless Action, among other things. And so it's time to go all in. I will now turn it over to 1st District Councilwoman Mary Zendejas.
Thank you, Mayor. Good morning, everyone. We are here this morning in the heart of downtown, which has been a growing area of concern from our entire community. As the mayor mentioned, homelessness has been growing over the past few years, and it has only exacerbated since the onset of the pandemic. While we have strived to add more interim housing and supportive services to meet the demand of our unhoused community, we are still in deficit, particularly here in the downtown area. And with the cold weather months ahead of us, shelter and housing are even more important, as our unhoused are likely to face heightened exposure and danger from living outdoors. We take great pride in our community, and so we must do better and take care of our community and our people, especially our unhoused, but also our house. This is all of our communities. I look forward to working in collaboration with the city and our community to resolve this crisis and create a better, safer Long Beach for all of us.
Thank you, Councilwoman. And now we're going to turn it over to our City Manager, Tom Modica.
Thank you, Mayor. Thank you, Council Member. Good morning. So it's been a really busy week here in Long Beach. As the Mayor said, we're ready to tackle this crisis head on and with greater urgency. Since proclaiming the state of emergency on Tuesday, we have assembled immediately 100 top city leaders, all coming together to help us respond to this urgent crisis. We swiftly activated our Emergency Operations Center, we established an incident command, and we've identified 9 work groups to take on all the various aspects of our emergency response. Similar to our response during the COVID-19 pandemic, which had been nationally recognized, the incident command structure will allow personnel from nearly every city department to work collaboratively. That provides a framework to manage federal, state, and regional assets and provides logistical and administrative support to ensure that our operational staff have the tools that they need. Simply put, this emergency structure will allow us to not get in our own way and to be even more effective at reaching people in need. Our Health Department Director, Kelly Colopy, and our Public Works Director, Eric Lopez, will serve jointly as our Emergency Operations Center Incident Command. Our Emergency Operations Center will coordinate all the various efforts with our City Management Group, including my office, our Public Affairs officers, our City Attorney, and leading with equity as well through our City Equity Officer. The emergency proclamation will allow much of our city processes to be expedited. We now have the flexibility to reassign staff resources and specific focus areas. We let all 6,000 of our employees know yesterday that they could be considered disaster workers and be part of our response if we need them. We expedited recruitment and selection process for our various positions. We've increased the ability to purchase faster and quicker at higher levels and streamlined the procurement process as it relates to contracts and purchasing, especially as it relates to contracting construction activities, which we'll be bringing to council as well. Since this is a local emergency, however, there is no FEMA reimbursement opportunity, and so we're going to have to look within first of what dollars we can reprioritize, and at the same time, we are going to be asking for additional assistance and resources, as this city has shown that we can provide so much when we have the resources. Our mission with this proclamation is simple. We're going to reduce the amount of people experiencing homelessness in the city and the region by increasing housing opportunities, enhancing current initiatives that provide field-based outreach, engagement, and supported services, address and improve public safety for the entire community. This is a humanitarian crisis and public health and safety crisis, so we must approach this with as much strategy and urgency as we do with compassion. And so as the mayor shared earlier, we will be focusing our efforts in the downtown area over the next few weeks. There's a large area of concern for residents, businesses, and stakeholders and our entire community, and we must take stronger action. So in addition to the enhanced outreach services for those experiencing homelessness, we're also looking at flexibility for property owners to install adequate fencing to secure vacant buildings and lots and enhance security, and that's something we loosened on Tuesday. We'll be processing affordable housing projects within 60 days and prioritizing homeless-related permits and inspections for any of our capital improvement projects related to homelessness. We're also going to be engaging our local educational institutions, our businesses, our faith-based organizations and nonprofit organizations to expand what they currently do, expand their capacity, expand their resources, and help us continue to help people experiencing homelessness. And we'll be collaborating with this group to develop upstream prevention strategies as well to identify and to enact solutions for the root causes of homelessness. And so in conclusion, we are fully committed to improving the homelessness crisis we are experiencing both locally and throughout the region. I want to extend my sincere thanks to our mayor, our city council for their support and their leadership on this emergency proclamation, to our city staff for their relentless dedication and service to our community, and our residents, business owners, and community organizations and stakeholders for all of their patience, understanding as we navigate this together as a community. At this point, I'd like to turn it over to our Health Department Director and Incident Commander, Kelly Colopy, one of our co-incident commanders, who will share more information about the efforts that are going to take place in downtown. Kelly.
Good morning, everybody. It's nice to see you all today. Thanks for being here. We are coming together under some tough circumstances, but it's a privilege to be here and to be able to share with you the work that we're getting ready to take on. So despite all of our enhanced efforts to help people experiencing homelessness over the past few years, it seems like this emergency proclamation was really inevitable. When we conducted our 2020 point-in-time count last February, it was revealed that we had an overall rise in homelessness of 62% since 2020. It was revealed that people of color, that are Black, Indigenous, and Pacific Islanders, are 3 times more likely to become homeless than other populations, and that the number of homeless veterans has grown by 48%. Then more than 40% of people experiencing homelessness have had violence or trauma in their lives. 6% were fleeing violence when they became homeless. And then many have physical and mental illness that impacts their ability to engage in the day-to-day. This prevalence of the extreme need is really one of the key reasons why this emergency proclamation is so critical, because it's stressing our ability to respond at the level that we want to be able to respond, and we know we need to do more. So while behind all of this, when we talk about our homeless people, when we talk about people experiencing homelessness and our unhoused, we need to understand that within each number that you hear, that nearly 3,000 people, or over 3,000 people, we have to remember that each number is a name, each number is a face, each number is a human being, someone who has had family, friends, and a life. They're real people who are hurting and who need our help, and every day that they're living unhoused exposes them to elements that significantly drop their quality of life. In fact, the average age of death for someone experiencing homelessness is 47. So in this last year, 101 people died on our streets. Each year, the Long Beach Homeless Coalition hosts a homeless memorial at the Forest Lawn Cemetery. It's held on December 21st, the longest night of the year. And we read the names, and we light candles for every single person. And I will tell you, I do it whenever I can. I carry my cards with me of the names to ground me in what it means. It's heartbreaking, and it reminds you of that we need to all be together doing so much more, because this just can't happen anymore. So beginning today, as the starting point, and over the next 3 weeks, we'll be centralizing our emergency response efforts in downtown. Our homeless services outreach teams will enhance outreach efforts with our interdepartmental team, increase staffing and expanded hours to conduct meaningful engagement with our unhoused residents. This includes our REACH team, quality of life officers, the Long Beach Fire Department, our Public Works Clean team, and other community and county partners. This means more city staff dedicated to these efforts, more time spent in designated areas to reach more people. These teams will educate people who are experiencing homelessness about the services and resources available to them. We are also launching our new Mobile Access Center. The Mobile Access Center is a game changer for us in lowering barriers to providing case management services and other resources to people experiencing homelessness who are out in the field. Unlike other forms of street outreach, it allows us to start the intake process right there, right when we can connect with them. It's staffed by members of our Homeless Services Bureau and a public health nurse who will be doing routine checkups. The van offers nearly everything that we have at the Multi-Service Center, except for the co-located nonprofits, and there is not a medical clinic, but we do have a public health nurse. So we're very excited to really bring the services directly out into the community. The mobile access vehicle will travel around the downtown. It's over here. You'll be able to see it, focusing on the Promenade, the Billie Jean King Library, and the Civic Center at this time. Over the coming weeks, our incident command will continue to work across city departments and with local community organizations and neighboring jurisdictions to roll out additional actions. We're looking at opportunities to open additional emergency shelters, interim housing, safe parking, and mental health care. We're also working to accelerate permanent supportive housing to provide long-term solutions. I want to thank all of you and thank you to our many outreach workers, our case managers, and our other staff at the Homeless Services Bureau. They put their hearts into this work every single day, and the work is not easy. We have a lot of work ahead of us, but we will remain dedicated to helping people access shelter and permanent supportive housing. I know we'll be able to do even more great work with this additional support of our city staff, community members, businesses, nonprofits, and our regional and state partners. The homelessness crisis did not start overnight, and it won't be solved overnight either. But together we can move the needle, getting roofs over the heads for as many people as possible, while we look at ways to improve health conditions for everyone across our city. So thank you, and with that, I'm going to turn it over to Jen Rice-Epstein, our PIO. Oh, sorry, I'm turning it over to the mayor, and then he'll field questions. Thank you.
Okay, we're going to go ahead and take questions here.
Thank you. So we want to just first thank our entire city team who's joined us today, Public Safety, Health Department, Public Works Department, the stakeholders that we see here in the community. I want to acknowledge Austin, the head of the Downtown Long Beach Associates, the community members who are here, and the homeless outreach workers who are here with us today. At this point, we'll see if there are any questions for our team. Right here. So for that, I'm going to pass it to our city manager, but I believe we have one today, but we have three, correct? We have three. We have one today. All right.
So part of what we did during the pandemic is we had 4 outreach workers prior to the pandemic that were serving the city. We've grown that to 27 outreach workers. So we have really grown our outreach staff. We're now adding another component of outreach, even enhanced, which is the Mobile Access Center. So we have one today. These vehicles just got in. We're just putting them out into service. It's going to be a new level of outreach so you can actually do work right there on the street rather than engaging people and bringing them into the multi-service center. And we have plans to roll out a second one as soon as we can, getting the rest of that, that vehicle outfitted.
So there's one. There's one on the way, the second one, and the 3 I mentioned, there's now 3 funded REACH teams. Those are homeless outreach teams. Thanks. Next question.
We'll take questions here on this microphone. If you can please state your organization and your name.
Hi, Alicia Robinson with the Long Beach Post. Mayor, during your State of the City address, you mentioned a couple of new initiatives, including the city's going to try to support the creation of sort of mental health care facilities, recuperative beds, and then also asking the local colleges and school districts to try to support housing. Can you elaborate on both of those?
So you're talking about two recommendations in our Opportunity Beach 100-day plan. One focuses on localizing our capacity to deal with mental health issues. About a year ago, there was a request to City Council to explore and engage with the county around things that we could partner on locally. We hosted a roundtable. We brought hospitals and others together, and now some of those recommendations are coming back to City Council to explore what we can do. One of the biggest things that the hospitals raised was, hey, we need more recuperative care, step-down facilities, so when someone, goes into the hospital because they have a cut arm, sure, you can cut that arm, but there are issues that need to be resolved from an emotional standpoint, or that may take more than 3 days. And so recuperative care gives you a couple weeks to sort of recuperate. And so we're exploring those strategies, and I'm going to pass it to Kelly to talk about when we think we can get started on that.
So in the past year, we've been working with the Mental Health Advisory Group and a consultant about the different mechanisms for how we could start to draw additional resources into the city. We are continuing to do that work, and we anticipate coming back with a report in the next few months. In the meantime, we're also looking at a much broader partnership with LA County, who is the primary provider of the mental health services for the city of Long Beach. We know it's essential to have that partnership. We'll be working very closely with them as the department, as well as with other regional leaders to be able to increase those access. And as the mayor said, step-down beds, recuperative care are key to be able to allow people out of the hospital and to be able to recover safely.
Any additional questions?
And, well, I didn't respond to the second part of your question. So the other part is the Long Beach Housing Promise. So this is a proposal, and, I've had some preliminary discussions, and now we're going to begin more formal discussions with industry partners and education partners about ways we can partner to increase the housing stock. This could be surplus land opportunities and partnership across agencies, and we've done those things before. It could also be exploring different ways to fund housing that's affordable for families or teachers or educators or students, because it's in all our shared interest to explore these things. We have a real issue with the rising cost of housing that impacts working families with students on free and reduced lunch. Also, we have an issue with student homelessness, and so we have a vested interest together, so I look forward to exploring that. The last thing I was going to say is the incident command structure has an interagency team that was stood up yesterday. That team will help do some of the discussions around localizing mental health and engaging with other agencies. So that will actually be a part of our effort. Thanks. Who's next?
Hi, Christy Hutchings, Press Telegram. I'm just wondering if you have a specific target number of how many additional homeless outreach workers you're planning to add on to homeless services, and if you're planning to expand hours at the multi-service center or anything like that.
Yes, on multi-service center. We certainly are. I'm going to invite up Kelly to talk about how. And we're already expanding homeless outreach. We just funded an additional reach team, which we're working to bring online. The emergency will allow us to look at additional resources that we can put into the mix as well. So, Kelly?
So do I have a specific number? I don't for the for the outreach workers, but we are looking at our overall capacity and the need, and we'll be working to to start to build up that team as necessary. In terms of the multi-service hours, so one really nice part is the mobile access centers are really like multi-service centers right out in our community. So for every hour that they are there, it's actually an expansion of our multi-service hours. So we'll be having two teams as soon as we get the other van in and the rest of the team, and they'll be localized, and then we'll be looking at what is the capacity and the resource we can bring at the multi-service center itself.
All right. Any other questions?
One more question.
Sorry, I was just wondering if you can tell me how the mobile access centers are funded and how much they're costing the city.
Paul, you want to jump in?
Hello, everyone. We are using some of the American Rescue Plan funding that we got in through our home allocation through HUD, so that's a little bit different of a cycle. So we have funding for the next 3 years in order to operate our mobile access centers.
All right. We have a question over here.
Hi, KCAL News, Rena Nakano. Question about the actual declaration itself. I know that you guys talked about being able to cut some of the red tape and expedite things. Can you talk a little bit more specifically on what allows you, the mayor, or the city manager to do in terms of signing things off? Do you have to have people vote? Can you skip the vote? How much money can you sign off on immediately versus a vote? Things like that. Thank you.
Sure. And I'm going to invite up the city manager, but broadly, it increases purchasing authority on behalf of the city manager. City council still needs to be involved. Every 2 weeks, you have to renew the declaration. And so this will come back and will be more information to the city council for the city council to get updates. We also are going to establish some metrics for success, and that will continue to develop over time. But I want to bring up Tom to answer more specifically.
Thank you, Mayor. So this is the same protocols that we use very effectively in COVID. The city manager under the charter has the ability to spend up to $100,000 or $200,000, depending on how it's bid. This now brings that up to $1 million. So we still need the dollars. The council still needs to approve the budget, but if we know it's something that they want us to work on, it's in a work plan, we can speed the procurement, we can get it out quicker, and then we're able to actually contract for those services and then do notification to the council afterwards. That can save weeks and sometimes even months in major procurements, especially helpful in construction. We'll be looking at different ways to be able to bring on either our tiny homes quicker, accelerate a motel that we have purchased so we can get that up and running more quickly. It also allows us to move employees around a little bit faster and bring them into the mix. And in general, it just creates this sense of urgency. And our departments feel it, our employees feel it, and that helps a lot to just bring and speed the response.
All right. Any additional questions? Going once. Okay, so again, thank you so much for coming out. This is a top priority for our city. We know that as you can see, we have an incredible city. Our future is bright, but we can only achieve our highest potential if we're able to work together, overcome our biggest challenges. And right now, our priority focus is homelessness, making sure that we lead with urgency and with empathy and make a real meaningful difference to the lives of people who are living on our streets. Thank you so much. Now we'll have Spanish interpretation.
Buenos días a todos. Nos acompaña el alcalde Rex Richardson, la concejal del primer distrito Mary Sendejas, el gestor municipal Tom Modica y la directora del Departamento de Salud Kelly Colopy, y estamos afuera de la biblioteca principal Billie Jean King en el centro. Estamos aquí hoy día para compartir actualizaciones acerca de nuestros esfuerzos de movilización y el enfoque centralizado en el centro para responder a la crisis de las personas sin hogar. Esta semana nuestro Consejo Municipal adoptó la proclamación de la emergencia de personas sin hogar local. La proclamación es un estado de emergencia que nos va a permitir abordar esta crisis y poder acelerar el nivel. Nos va a permitir tener recursos locales y móviles. También nos va a permitir tener una respuesta entre agencias o interagencial coordinada, acelerar la licitación o la adquisición de unidades de viviendas y buscar ayuda de los gobiernos del condado, estado y federal. Este aumento en el enfoque en los fondos y los recursos nos apoyarán en los esfuerzos de alcance para la comunidad de personas sin hogares y nos va a permitir de manera eficaz y también con compasión y urgencia ser más estratégicos acerca de nuestra respuesta. Desde el 2017 hemos visto un aumento de 77% de personas sin hogar. A pesar de nuestros esfuerzos aumentados para ayudar a las personas que no tienen hogar en los últimos años, esta emergencia o esta proclamación de emergencia fue inevitable. Llevamos a cabo una tasa en el momento del 2022, el febrero pasado, que nos reveló un aumento en general de personas sin hogar de 62% desde la última vez que se hizo el conteo de la tasa a principios del 2020. Se reveló que las personas de color, las personas negras, indígenas y de las Islas Pacíficas son 3 veces más probables de estar sin hogar que otras poblaciones. Y eso también incluye un número de veteranos sin hogar que ha aumentado por 48%. Más de 40% de las personas que están sin hogar han pasado por trauma o violencia en sus hogares, o en sus vidas, perdón. y 6% estuvieron huyendo de violencia y se encontraron sin hogar. Mientras las cifras son importantes, debemos de recordar que cada número es un nombre, una cara, un ser humano, alguien con una familia, amistades y una vida. Estas personas son reales, están sufriendo y necesitan nuestra ayuda. Las personas sin hogar pueden crear un potencial de riesgos de seguridad y de salud pública en nuestra ciudad. Y mientras estamos trabajando de manera diligente para abordar este asunto, ahora es una crisis que requiere mayor acción de todos nosotros. Desde la proclamación hemos activado nuestro centro de operaciones de emergencia y hemos anunciado una estructura de mando de incidente dirigido por el Departamento de Salud y el Departamento de Obras Públicas y compuesto de personal de la ciudad de casi cada departamento. Empezando hoy y a través de las próximas 3 semanas, vamos a centralizar nuestro enfoque en los recursos en el área del centro. Esto incluye un aumento de alcance en las calles, un desplazo de un nuevo centro de acceso móvil que va a conectar a las personas sin hogar con servicios y recursos directamente en las calles del centro. También empezando hoy vamos a desplazar nuestro nuevo centro móvil de acceso. Este centro de acceso móvil es un punto de inflexión para disminuir las barreras y proveer servicios de gestión de casos y otros recursos para las personas sin hogar en el campo. En otros alcances en la calle nos permitirá también tener un proceso directamente con las personas. Tenemos a miembros del personal del Departamento de Servicios de Personas sin Hogar y una enfermera de salud pública quienes van a ofrecer chequeos o exámenes de rutina. Además de nuestros servicios de alcance aumentados para las personas sin hogar, también estamos viendo la flexibilidad de propietarios en instalar cercas adecuadas para asegurar los edificios vacíos y también los lotes vacíos y para mejorar la seguridad. Procesar proyectos de viviendas asequibles dentro de 60 días y priorizar permisos relacionados a personas sin hogar e inspecciones relacionadas a personas sin hogar para proyectos de mejoras de capital y proveer alivio rápido al centro. Las personas sin hogar es un desafío grande que nuestra ciudad enfrenta actualmente y tenemos mucho trabajo que hacer. Les aseguro a cada uno y a cada miembro de nuestra comunidad en la ciudad de Long Beach que estamos trabajando duro para restaurar la fe y la confianza a quienes servimos. Gracias.
All right. Thank you, everybody, for coming. We do have the Mobile Access Center here on site. It's right over here parked on Pacific, so if anyone would like to check that out or learn more about the Mobile Access Center, please join us over there. Thank you so much.